Gina Dennik-Champion, CEO of the Wisconsin Nurses Association, Mike Flesher, CEO of the Wisconsin Medical Society, John Nygren, Executive Director of the Wisconsin Association of Health Plans, and John Sauer, CEO of LeadingAge Wisconsin. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. These important discussions would not be possible without their support. So a huge thank you to Advocate Aurora Health, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gundersen Health System, Husch Blackwell, and WPS Health Insurance. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you are not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Advocate Aurora Health, today's featured sponsor. We are very grateful for all of their very generous and continued support. Here to say a few words is Vincent Lyles, Vice President of Community Relations for Advocate Aurora Health.
Thanks, Tim. On behalf of Advocate Aurora Health, I'm honored to welcome you all to this afternoon's program. Please join me in thanking Tim and his staff for always finding ways to bring us together. What do the midterm elections mean for our country, for Wisconsin, and for our industry? We don't know, which is why Wisconsin Health News brought together this esteemed group of panelists to present the details, to discuss the people changes, and to highlight the legislative agendas forthcoming. Speaking of that, I would love to stay and listen, but my team and I are celebrating some birthdays. Like all of you, we want to have the chance to come together and appreciate each other and our collective commitment to helping people live well. In closing, I'll leave you with this thought. Our form of politics is fundamentally sound. And when people speak, as they did on November 8th, we are saying something very important. And being a good leader today is much more about influence than authority. So learning to adapt to the people with different perspectives, priorities, and personalities is a key skill for all of us to work on. With that, I'll turn it over to Tim and let the panel get started. Thank you all.
Great. Thank you, Vincent. Thanks so much for all of the support from you and Advocate Aurora Health. We're very appreciative of that, and happy birthday to your colleagues today. And thanks again to our panelists for sharing some of their valuable time with us today. We are 3 weeks removed from the latest elections, and while the balance of power in the state will not shift, there will be new lawmakers taking office and new lawmakers heading key committees, which could have a big impact on healthcare here in Wisconsin. Meanwhile, at the national level, Republicans are taking over the U.S. House of Representatives. So we've assembled some of the state's top healthcare lobbyists today to help break down what it all means for healthcare in Wisconsin. We're also hoping to get a preview of some of the top issues that they will be taking on and working on during this upcoming legislative session, a session which will be dominated by efforts by Governor Evers and a Republican-controlled legislature to put together the state's next 2-year spending plan. So John Nygren, let's start with you. What do you think will be some of the biggest impacts of the recent elections on healthcare in Wisconsin?
Honestly, here in Wisconsin, I don't know that we're going to see a significant shift. A lot of the focus was on, will the Republicans get to supermajorities in the Assembly and the Senate? And while they did in the Senate, announcement last week of Senator Darling retiring after a long and distinguished career in state government, puts that question back before the voters in what will be a special election coming up. So I don't know that we're going to see a lot of change. I think some of the tones coming out of both the legislative Republicans and Governor Evers' office gives us some hope that there's an opportunity to work together. But the true proof will be in the pudding, as they say, moving forward. So I would say stay tuned.
Great. John Sauer, what do you think about that? Is it going to be kind of similar as to how it's been in recent years, or do you expect some changes as a result of these elections?
Well, I do think it was significant, as I would agree with John, is that since there is no supermajority in each house, the checks and balances and the opportunities then to come back and work together, I think, is still out there. And I guess we will see how it works. But I think we're going to have a process that'll look similar to what the last budget looked like. And, I think we'll just see how it plays out. But I'm optimistic that people will come together on healthcare issues.
Eric, as Governor Evers enters a second term, are you expecting turnover any turnover in some of the key cabinet positions? I mean, right now we have interim leaders for both health and insurance. Do you expect some new leadership? And if so, how are you preparing for that?
Well, before I answer that question, speaking of long and distinguished careers, I am going to go off script here for a minute and just congratulate my colleague, John Sauer, for his long and very distinguished career. John's hanging it up, I think, next month. And I've been at this a long time, and I can't think of someone who's been more committed and passionate in what they do. So I just wanted to recognize John Sauer for his great contributions and career. I'll
second that. John, thanks again for doing this, and it's been so great working with you over the years.
Well, if I can take 2 minutes, actually 2 seconds, I'll say thank you. Eric, that was very kind of you, and I appreciate it. I've enjoyed working in this state and on these healthcare and long-term care issues. It's been an honor to serve our members through the association, and our interactions have always been robust and honest, and it's been an enjoyable career, made more interesting and more challenging and enjoyable because of the issues that we are trying to solve together. So I appreciate it.
What was the question again? No, just kidding.
You were going to tell us who's going to be heading the health and insurance departments.
Yeah, well, there's a lot of turnover after elections. Not while both John and John mentioned, responded to the question about the legislature. Not a lot of change there, but a lot of new legislators. Like there are every 2 years. So while the balance of power hasn't changed too much, a lot of new people coming in, a lot of new decision makers coming in, a lot of new staff coming in, and that's always an opportunity going into a every 2-year cycle. As far as the cabinet, there's always change, whether it be during a governor's first term or at the end of that term or at the beginning of a second term. So, I'm not aware of any specific changes that are going to take place. I wouldn't be surprised if there are some people decide that, they've put in, some service and it's time to move on. I think I probably speak for all of our organizations when I say that, this is going to happen. If you're in the advocacy world and the legislative advocacy world, change is a constant, to quote my favorite lyricist, constant change is here to stay. And so you always have to be thinking about who's coming in and making sure that when they do come in, whether that be at the legislature or at the cabinet level, that you're having interactions with them and that they're understanding issues from your perspective. So can't comment specifically on any that are going to be changing, but I wouldn't be surprised if there would be some.
Great. Gina, as you look at a legislative landscape that looks similar to recent years, but as Eric mentioned, with some new members, maybe some new members heading some of these key committees, what are your top priorities going to be for this upcoming legislative session?
Well, I think as Eric was talking, is number one, we need to build relationships with all these newbies as well as, our folks that have been around. It's always great to develop that relationship with our cabinet members. I think for us is to really help them understand what's going on in healthcare, and that it's that everyone needs to be aware of that it really is a serious issue, and that we're really hoping that what we are all, asking for, that a lot of it can be addressed and taken care of. Certainly the workforce shortage is huge as for, our nurses. They're getting tired, but I want to say the bigger things that we worked on and we're very close to last session was our Advanced Practice Registered Nurse Modernization Act, which will provide licensure, a separate licensure of those nurses that are nurse practitioners, clinical nurse specialists, nurse anesthetists, and our nurse midwife. So we're really hoping we can, get that way over the fence. The other thing as we look at the workforce shortage is that the need for more nurse faculty. We can't grow our numbers of nurses if we don't have the faculty in place, and data shows how few of those faculty members that we have, and they're intent on leaving. So the picture looks pretty bleak if we're hoping that the loan forgiveness dollars that were allocated last time will appear in the budget. And then I think our last is to, kind of recognize those nurses so that, to support their work is we would like to offer a tax credit to those nurses that are working as preceptors. So they're taking on the job right now of not enough nurses, but they're also taking on the job of being a preceptor for the undergrad nursing student as well as the graduate level. So I think those are our big three.
Great. So as you mentioned, the APRN bill that you've been working on for a while now, and we're pretty close last session. It passed the legislature, but was ultimately vetoed by the governor. As you come back now with it again in this session, are you looking at compromises? Are you looking at maybe the similar bill kind of going forward? What was kind of the strategy for that piece of legislation?
Mike, do you want to answer that we've been?
Well, no, thank you. And actually Gina and I and our lobbying teams have met a number of times. So we know that it's an important bill that I know that the governor wants to see something happen. The legislature wants to see something happen. So we're working with the Wisconsin Nursing Association very closely. Now we have other nursing groups and other physician groups that we've got to bring along with us. So, but we're hoping to make progress on that front. So, but so far conversations, our in-person meetings have been very positive. Don't you agree, Gina?
Yes, and it is something the governor really wanted us to,
get together,
work on this summer and this fall, and so we're getting there.
Yep, we're very optimistic.
Fingers crossed.
Great. And Mike, let's stick with you. What are some of your other priorities for the upcoming legislative session for the?
Yeah, and thanks again, Tim, for the opportunity. And like many of the distinguished colleagues on this panel, a lot of our members, are in contact and taking care of patients. The patient-physician relationship, the provider-patient relationship, we do hear a lot. We have a pulse of what's going on in healthcare, and really from a physician perspective. And I know Gina and Eric and the Johns can also speak to this, but physician health is going to be a big focus of our medical societies. Physician health, patient access to care, and really workforce issues that Gina mentioned. I think just coming out of COVID, there was a lot of heroes in medicine on the front lines, and that has unfortunately changed. And, from an anti-vaccination crowd to even a lot of nurses and providers, physicians facing verbal, even physical abuse in some clinics, not being able to provide that care to some of our patients because of that frustration, or if it's administrative red tape, electronic medical records, physicians, healthcare professionals, at least I can speak for physicians, are frustrated, are tired. So that's going to be a big focus of working with all of us on this panel and many of the other groups to focus in on that. Patient access to care, as physicians are frustrated, patients are frustrated. So from the cost of healthcare to being able to get in to see their providers, their doctors, these are things that our physicians are hearing through the patient visits, and a lot of the headaches around prior authorization. So we're going to be focusing in on patient access to care, and then, as many of us have been on different panels on the workforce issues, we hear from docs, we hear from administrators, in the large systems, in the small practices, just how difficult it is to find people, find workers, find physicians. Licensing issues, getting licensings for these providers has been a frustration. I know that we're real optimistic that improvement's going to happen there. So really just those areas are ones that we're going to be focusing on for physicians. Great.
Sounds like a full plate. To John Sauer, how would you answer that? What are nursing homes going to be focused on in the long-term care community this upcoming session?
Tim, there are two issues. The first has to do with nursing homes. The second has to do with family care and home and community-based services. So on the first issue for nursing home, we've been championing the idea of systemic nursing home payment reform so that nursing facilities can have confidence that as they spend more, invest more in their direct care staff, that the Medicaid dollars will be there to pay its portion of the cost. Up until probably 3 or 4 years ago, we had a very, very underfunded, significantly underfunded, perhaps the worst in the country of our reimbursement system relative to paying for the cost of care. We're embarking now on this, made some progress certainly in the last few years to payment reform, and we're hoping that the governor will recommend, the legislature will fully support moving to a payment standard so that facilities know from year to year that we won't be riding this roller coaster of a reimbursement system. We'll have stability, allowing for sustainability and predictability within our system. And that's how we're going to keep facilities open and hopefully been able to attract the staff that they need. So systemic payment reform being one. The second issue.
Sorry, John, just to follow up on that, could you just kind of expound on that a little bit more? I mean, what would be some of those key points, that some of the key changes that would be made to ensure some of that stability?
Yeah, I can think of 3 very quick things. One is we used to pay at a reimbursement standard far below the median cost of care. This recent formula the state has adopted is paying at the median, call it the average, the median cost of what it costs to provide care by RNs, LPNs, and CNAs. And the standard now is at the median plus 25%. So that's a standard that should be funded year after year. And so that having that payment standard there gives providers the confidence that they can invest in their direct care staff and the dollars are going to be there to pay for it. The same thing also happens, we need a payment standard, and we don't even pay anywhere near the median in what we call support services. Think housekeeping, dietary, laundry, maintenance people, those folks who have a direct impact on the quality of life of nursing home residents. If we establish a payment standard there, the same thing holds true. It can be predictable and sustainable. And the third thing is we really haven't changed how we pay for property or think of capital expenses in nursing homes. And many facilities in the state need to modernize their facilities, but the reimbursement system literally paying for the debt service, depreciation, remodeling, renovation, that's payment standard has been changed in at least 15 years. So those are 3 things that we could do to improve and create a standard for nursing homes. The second area I was going to talk about was in the family care, and there's been almost universal agreement that we've spent a lot of time expanding family care, eliminating the institutional bias of Medicaid, having a system where you're now entitled for a full array of Medicaid services if you're financially and functionally eligible. But we've spent almost no time looking at what about the people who are actually providing that care. So we expanded it, we've eliminated waiting lists, and now's the time to invest in the people who are actually providing the care. And the way to do that, people have grown frustrated trying to hope that they're able to extract enough money from the managed care organizations to pay the cost of care, to pay their caregivers. We've kind of lost hope that that is a system that's going to materialize into improved wages and benefits for caregivers. So we're now all in on the idea of establishing rate bands or a fee schedule under the family care program that the MCOs would have to follow. We need to spend less time on the infrastructure of mechanics of how family care operates, and more time about how do we get dollars to the people who are actually providing the care. And our hope is that a well-funded fee schedule or rate bands that the MCOs will require to follow, at least at the very minimum, will be a way to target dollars to people providing the care. So those are the two things we're primarily focused on, and then a whole slew of workforce related things that we can talk about later.
Excellent. Thank you, John. John Nygren, what are health plans focused on for this upcoming session?
Well, I mean, we always, access to affordable care, whether it be through a commercial market, whether it be through Medicaid. That's something we always are concerned about, keeping the cost down for the consumers in Wisconsin. With that in mind, we've had bipartisan support on our reinsurance program here in the state. We had an increase in this last budget to $230 million. Governor, that was proposed by Republicans in the Joint Finance Committee. Governor Evers signed it into law. So I mean, it's nice to have something that we can point to as a success for keeping costs down. So that's going to be something we're going to continue to focus on. I would make a little news right now by saying that I just got out of a board meeting, and for the first time ever in 2023, our association will be advocating in the Medicaid long-term care space. So John, sorry to see that you're going to be leaving here in the next month, but we're excited about adding not only My Choice Wisconsin as an MCO and also a commercial insurer who's been a member of ours for some years, but also adding Lakeland Care to our association, and potentially, more growth down the road. These are very complicated issues. I mean, John pointed out there has been some movement in the past on some of these things. Actually, as a co-chair, I was part of those. So I mean, there's been direct payments to be able to hope to address some of the workforce issues. I think those conversations need to be, how best do we get those dollars to where they're needed within the capitation rate. I think those are things that we're going to care about in the next 2023 as we venture into this new area.
Excellent. Eric, what about you? What are hospitals' top priorities this session?
Well, let's see how much time we have. 35 minutes. 5 things. No, just kidding. John Sauer. Well, reimbursement, of course, always a budget issue. When you think of the fact that hospitals in Wisconsin, on average, have either Medicare and Medicaid combined are comprising 60-65% of their payer mix. The reimbursement from those programs, which is woefully below cost, has a real impact, especially as both enrollment in both those programs are growing. And the ability to recoup those costs, to shift those costs to everyone else, is shrinking very rapidly. So reimbursement will continue to be a top priority for us going into the next budget, as it always is. I agree with the comments that John Nygren just made, if I understood them, and that was to make sure that dollars, particularly in the long-term care space, whether through MCOs or directly, are actually going to expand capacity, going to the workforce and expand capacity, because that's very, very important to us, more so in the last 2 or 3 years during COVID than it has been in the past. So reimbursement, big issue for a lot of different reasons. By the way, another reason reimbursement is a big issue is when you have an industry like hospitals that 65% of their payer mix is government healthcare programs, that undeniably affects and skews the healthcare marketplace. You cannot ignore that or pretend that it does not exist. And so when we have a conversation about cost and the marketplace and competition and all of those things, which are wrapped up into about a dozen different pieces of public policy, you have to acknowledge the market impact that those government programs have. Second thing I'll mention, and of course, everyone else here has mentioned this, I think certainly for four of us, this is a huge issue, and that is workforce. We have seen the cost of providing care explode over the last few years. And that is a challenge both in addressing that cost, which the options to address cost of your workforce, your and wage inflation aren't that great. But, and I think Gina touched on this a little bit, it's also two other things. It's that flow of people into a healthcare profession, and how can we increase that? And I look around at some of our other states, some of our competitor states. I look at Michigan, for example. They are investing a lot of money in their healthcare workforce right now. And that's just not just an idle observation. Michigan is right on our border, obviously, and we are competing for healthcare workers with all the states around us. Second of all, and I think this is an area where we'll be able to achieve some bipartisan, I hope, compromise, and that is in licensure and regulatory reform. And this goes to better utilizing the workforce, the healthcare workforce, and the healthcare professionals that we have in Wisconsin right now, whether that be those advanced practice clinicians and other types of providers that are already here in Wisconsin, or those that are trying to come and be healthcare workers in Wisconsin, and not just the APCs, but everyone else that's trying to simply get approval from the state, otherwise known as a license, to be a healthcare worker. This is a real challenge. And there's obviously a Ledge Council study committee that's looking at this. I think it's an area that is really ripe for change and reform. And as easy as that is an issue to identify, I'll tell you that the solutions are not going to be that simple, because every single healthcare profession and every single educational institution has a stake in this question, has a piece of this, has a piece of that turf, if you will. So really important issues to address as it relates to our workforce, but no simply achieved solutions.
So just to follow up on that, Eric, in terms of licensure, are there going to be some specific proposals, ideas that you're looking at right now?
I think so. I think there'll be a few coming out of that committee. I think there'll be others that are floating around out there. And then, of course, we have a state budget that will once again, involve a debate over funding for DSPS, and that will be an interesting debate. There's a lot of finger pointing going on in this issue, as there is every issue. But I do think there's opportunities to make some progress. I'll give you an example. We had divided government last session. I'll be quick on this. And yeah, there were a lot of vetoes, but there are also a lot of bills signed into law, one of which took one of those lessons we've learned from COVID, which is COVID to me was a giant regulatory reform pilot project. It really was, and still is. And so we were able to, in a very bipartisan fashion, pass a law that says if you're licensed in another state in good standing to be a healthcare provider, and you apply for your license in Wisconsin, you should be immediately licensed to begin practicing here. And that's been a little rough in implementation. There's some confusion about what that law does and doesn't mean. But it's an example, Tim, of some reform, if you will, that 3 years ago, when we were all focusing on compacts, which was not a slam dunk. Mm-hmm. This is compacts on steroids, in my opinion. And so it's an example of how we can learn lessons and do some things that just a few years ago were unthinkable to do. But there's a lot of opportunities for more of that type of collaboration and progress.
Then, Eric, I want to stay with you just a little bit longer. Could you expound a little bit on reimbursement? I mean, what are some specific proposals regarding reimbursement that WHA may be trying to push forward this session?
Well, for us, it's Medicaid, of course. I think that's what we're talking about. And, there's a lot of different ways. I mean, I think it's a federal question too, which maybe that'll be a question later, but we try to focus Medicaid reimbursement improvements on those areas of greatest need, the disproportionate share hospital program, or affectionately known as DISH. I see John smiling. That does that tries to target dollars to those hospitals that, as the name suggests, have a disproportionate share of Medicaid patients. There are some hospitals in Wisconsin where they're 65% of their patients are Medicaid, right? Paying 65% of cost. So I think that's how we go about improving Medicaid reimbursement. I think there's plenty of options out there. By the way, we do have a hospital tax in this state. It's been many years ago that we created it, so it's kind of been forgotten, but it's about a $420 million annual tax, which pays about 2/3 of the state's cost of hospital reimbursement. So hospitals are essentially self-funding 2/3 of their own reimbursement. There's a big chunk of that tax, about $150 million, that's skimmed off every single year. And oh, by the way, we have an over $500 million projected Medicaid surplus, something like a $6 billion projected general fund surplus. Sometimes, when there's a surplus, that says you're overtaxed. So that might be something to also take a look at, is the skim on the hospital tax, and is that really necessary anymore? And that would be another way of improving reimbursement without actually pumping more GPR into the program.
And Tim, just to jump in just on, Medicaid has always been every perennial, Medicaid funding is so important, and especially to physicians and to the hospitals, everybody. I mean, they're for the patients that are most at risk, the sickest and the poorest, and we just think it needs to be a priority for increased Medicaid, and again, through some of the avenues that Eric mentioned. Really, hopefully they can come to the legislature and the governor's office come to some synergy on that, because there is such a need.
And Mike, are there any specific kind of Medicaid reimbursement proposals that you're looking at, or?
Well, not specifically that I can mention right now, but I just know with that $6 billion surplus, with some of the avenues that Eric is talking about, I think I think Wisconsin. I'm new to Wisconsin, but just from hearing from physicians and other colleagues at association world, I mean, Wisconsin has taken care of the people that need the care, and I think we need to continue to do that. But I think increasing and properly funding our Medicaid program is a huge priority. So we're willing to come to the table and brainstorm and work with the Hospital Association and the Nursing Association and all the groups that are here to figure out a way to advocate. Have our patients advocate, have our members advocate for that increased funding. But it's an important thing, I think, to mention here that needs proper funding so that the sickest and the poorest are getting the care they need.
And Wisconsin has done a heck of a job funding its Medicaid.
Yes,
it really has.
Yeah,
I think that has to be recognized. And as a non-Medicaid expansion state, the legislature has not abandoned in any way funding that program, while at the same time rejecting Medicaid expansion. So I think it's something that has to be recognized, that it has been a priority for years in Wisconsin, and I've heard legislative leadership say that it will remain a priority going into the state budget.
If I could share back in nursing home days when I was a nursing home administrator, and we had an old building, as John had indicated, not enough dollars to make the renovations possible because you needed it to pay for staff. But when I left, because of the age and kind of the other competition, that I ended up with 85% of those patients or those residents were Medicaid, and 5% were Medicare, and the rest were private pay. So it was a huge, I would say, tapping into those private pay to help cover the cost of the, and I think Medicaid reimbursement, just in terms of that long-term care system, really also needs to be looked at, because it's not good.
Gina, if I can jump in too, I mean, I remember when you were on our board and we were dealing with the Medicaid funding woes. We've had great improvement, and that's a reason for those in long-term care to be optimistic that continued investment. But we have a challenge in front of us. We've just since 2022, we've had about a dozen nursing homes close. More have downsized their capacity. We talk about the occupancy rate. We probably have 25% of our beds that are vacant, even though there's a growing need for our care and services. It comes down to staffing, and whether or not we have proven that if we invest more in our staff, we can do better in terms of reducing turnover and improve our hiring rates. So we have to do something to stem the tide. We're moving aggressively in that direction, but we can't lose sight of the prize. And we need sustainability, and we need to shore up. We're in the next 20 years, the over age 85 population is going to double. We have plenty of nursing home beds available in the state, but some are closing. The average Medicaid census is 66% Medicaid. So that's why all these issues are real to people who are trying to access long-term care.
Eric, last session, hospitals pushed, shifting gears just a little bit. Last session, hospitals pushed to ban the practice of white bagging, where payers choose the pharmacy used by providers for specialty drugs. Do you foresee that being a priority again this coming year?
Well, before I answer that, I have to kid John a little bit. I texted him the other day, said, John, the governor just gave you a wonderful retirement gift, funding nursing homes at 90% of cost. So may the icing on the cake of your career. Probably not, but you know what I'm saying. White bagging, we'll see. I think that there's a number of issues that I would put into the category of bureaucracy, red tape, regulation that stands in that occupies that space between the patient and the provider. It is a large chunk of bureaucracy, some of it government driven, some of it not. And white bagging, from my perspective, is an example of that. But there are many, many others. And frankly, I think that either through legislation or working collaboratively with some of the payers in this state, we might be able to make some progress on some of these issues. And there's many. It's like a whole industrial complex that exists between the patient and the provider. But we have a lot of Wisconsin is unique. I'm not trying to speak for John Nygren at all here. Wisconsin is very unique, and then we have a lot of provider-sponsored community health plans, and that's a unique thing for a reason. And I think that it also means that there's opportunity to collaborate and work together on a whole host of issues, ranging from regulation to transparency. So, Tim, we'll see what happens. I think there's a lot of issues out there to address, and we'll see what the forums and the venues are for those.
John Sauer, as has been talked about, and as Eric has touched on a little bit, there will again be divided state government, and in the past that has led to some agreement, some bipartisan agreement on some pretty key healthcare issues. This coming session, what do you foresee some key healthcare issues where there could be some bipartisan agreement on?
Well, I believe in, based on our conversations with elected officials on both sides of the aisle, our conversation that we had this week on the governor's budget request, I do think that long-term care issues in general are increasingly a bipartisan issue. And I think they're going to work together well about systemic payment reform, as I mentioned. And you know, when I walk in the legislator's office, or our lobbying team walks in, and we talk about family care, there is kind of almost universal agreement that we need to look at how the dollars are being spent and where they're being spent. And you know, it's very difficult to get home care workers, personal care workers. So I think there's going to be agreement that we need to look at how we're investing in long-term care. On the workforce side, I think what people can gravitate on is, you know, how do we build the pipeline? You know, how do we look at immigration? Can our state, you know, use the bully pulpit to move for sensible legal immigration reform so that more people want jobs? We have them in Wisconsin, and I think we have to become more a cheerleader about that on both sides of the aisle. And I think that's probably where people can kind of come together on the workforce issues as well.
Mike, Wisconsin is now going to be one of only 11 states in the country that have not expanded Medicaid under the Affordable Care Act. This remains a priority of Governor Evers, but Republican lawmakers have remained opposed. Do you see any movement this session on Medicaid expansion?
Well, I think, as Eric maybe mentioned, you know, we haven't done the expansion, and I don't think with the sort of status quo election and the split government, probably not. But I think, again, as I mentioned earlier, you know, I think Wisconsin's always made and from a policy making perspective, have made Medicaid and taking care of our most needy and poor populations a priority, and hopefully they'll continue to do that. I think other budget priorities are mothers who are on Medicaid, eligible when they are pregnant, should continue to get covered for that year postpartum. And then again, back to mentioning, you know, the licensing frustration that we all have. I know they're working on that, but additional resources for that are going to be really important. But I don't think you'll see an expansion of Medicaid.
John Nygren, would you agree with that? Not too long ago, you were a Republican lawmaker. This is something that voters support, even in red states like North Dakota. There's a strong financial case for it. Do you see any budging by your former colleagues this time around?
Actually, no, I don't. And I don't see any budging on either side, quite honestly. And, you know, I think the message from the voters is, you know, that they want them to work together. And as I started this conversation, you know, from the beginning, the tone at this point in time it seems to be heading in a much better direction than it has in the past. Now, that doesn't mean that Governor Tony Evers won't propose Medicaid expansion in his budget, and that the, you know, Joint Finance Committee led by Republicans won't yank it out on day one, because that's what's going to happen. But my advice to them is to trying to find things that they can work together on. And some of them have been discussed already by this group, you know, workforce, you know, while we aren't, you know, a major, you know, the tip of the spear on this issue per se, we still have, you know, in our world, we have workforce issues. And I know a number of you represented here do as well. You know, that's something I think they can work together on, trying to find ways to keep costs down for not only for you know, the providers, but for the consumer. You know, are there opportunities to find common ground on that? You know, Eric already mentioned a number of my members are provider-owned plans. We have a lot of similarities between our different organizations, yet oftentimes we end up on opposite sides of issues. But are there things that we could work together on? He and I are actually working to find those. And I think if the government follows a similar path, I think this will be a good session. If it continues to be gridlock and, you know, leading the record-breaking number of vetoes, then I don't think much is going to change. But I do think there's an opportunity for a new day here in Wisconsin.
Tim, can I add to that, or do you want to move on?
Yeah, please do.
I think those are both really good comments, and I agree. I think it's going to play out very similar to it has in the past. The good news is, you know, Wisconsin, we have one of the lowest uninsured rates in the country. in the top 10 in terms of the number of insured, and really in the almost near the top 5. And it's actually even higher than all but I think 12 or 13 of the states that have accepted Medicaid expansion. So, I think that says something. And I'll add, when you have a $6+ billion surplus, it kind of takes the financial aspect maybe isn't as pressing as it was two or three budgets ago. But having said all that, I think we got to recognize some of the great strengths of the state that are attributable to organizations and individuals represented that we represent on this call, and as well as many others. That we have a great healthcare system. It's not perfect, but it's pretty darn strong, and we have a lot of access to care, and that's a tribute to the way that we've gone about it in this state.
Eric,
Can I
Gina, go ahead, please. Yeah, go ahead.
So I think we'd be remiss if we didn't talk about building our public health infrastructure.
Totally agree.
Because that's where the prevention and teaching people with a chronic disease how they can better take care of themselves. It takes providers to help do that, but it's also those partnerships I think are needed between our health systems and those places, those community-based places or public health where we can really have better linkages. So to support the care of that individual. And, we look at rural Wisconsin and the amount of health disparities that are seen, and, not even enough broadband yet, but how we can pay attention to that. And also with that surplus, how can we manage to also get out of the walls, but back into the community?
Gina, I saw a lot of nodding heads on your comment about public health and prevention. Are there any specific proposals that you're aware of that are in the works to fund public health in Wisconsin?
Not that I'm aware of, but maybe I haven't seen the governor's budget. And I know he does care about the communities, and I'll defer to my folks who've read that whole budget and stayed awake. No.
Tim, can I jump in there? I don't. Gina makes a good point about public health. I'm glad she raised it, and it is about prevention, that aspect of public health. But I'll tell you, COVID, was both good and bad, right? There are some things that helped us better understand. It really did stress the public health system, and I know that because hospitals and health systems had to step in like never before to play sort of what I would consider more typical public health functions. Mm-hmm. And so there's a lot of aspects of public health that have been weakened as a result of COVID, and that are either going unaddressed or are being shifted in responsibility to sort of other players, while they have other things they also are being asked to do. So there's a lot of reasons to look really closely at public health and particularly in this next state budget.
I'm very appreciative of all of that, getting the test kits out, getting the vaccinations, getting, just was typically not you're right, vaccinations are typically not that sort of mass immunization, typically not a health system. But again, we found the gap.
Mike, I want to shift gears just a little bit. A medical society president, Dr. Wendy Malaska, said at a recent Wisconsin Health News event that physicians are in a, quote, rock and a hard place when it comes to reproductive health care in the state after the Supreme Court stops decision. They fear they could be charged with a felony if they provide an abortion due to a ban put in place in the state in 1849. On the other hand, they risk facing a malpractice suit if they don't provide care based on the current guidelines and standards of their practice. Is there anything, as we talk about, priorities, things for the next legislative session, is there anything you think that lawmakers could do to provide more clarity on this? I mean, anything that you will be advocating for?
Yeah, well, we're gonna, just likely anything that passes through the legislature, looks like it might be vetoed, especially with the court cases currently pending. But I think there needs to be continued conversation. I mean, we support policy, state legislation acknowledging the right for physicians to provide these kinds of services, or also support our members who refuse to perform them. But reproductive health is very important, and that, patient-physician relationship, provider-patient relationship is very important on this topic. So we're hoping that there'll be, more conversations than not about this. We're going to be continuing, as Dr. Malaska had mentioned, to help physicians maneuver in this space. We're looking to create a reproductive health task force with the different state specialty societies to really give a voice of the physician-patient relationship and how we can't have anything come in between that. So, but again, once we hear some of these court cases that are pending, hopefully there'll be some opportunity for the state government to be proactive on this end. And I know some recent comments by legislators, they're having conversations, and we're really excited to see that they're having conversations on the Senate and the House side about this issue. But
John Sauer, we're great. Thank you. John Sauer, we're quickly running out of time here, but I want to talk a little bit about federal issues. What are some of the top health issues that you're looking at, your association is looking at the federal level? I mean, is there anything you're monitoring during this lame duck period? And what impact do you think that divided government could have on healthcare at the federal level?
Well, I just think one of the things, I agree with what Eric said about we learned a lot. And one thing during the public health emergency, the Medicare provision that really said to a person, you need to stay 3 days in the hospital before you're going to be able to get your Medicare benefit for skilled nursing care, that was waived. And I think what we've seen is that it just allows now people to get the Medicare benefit that they paid for, that is supposed to be there as a Medicare benefit, without needlessly having to spend 1 or 2 more days in the hospital. And I'm hoping that, people will see the light to say that 3-day prior hospitalization was created, many decades ago, and it's antiquated and it needs to go. The other thing is, one thing that, Eric talked about as well, that, a $500 million deficit or surplus in the Medicaid program. Well, those dollars are, can be used to, further investment. And they were really fueled by the enhanced FMAP that came to Wisconsin, would have put our FMAP federal matching funds at like 70%. Expansion may not, Medicaid expansion likely not to happen. But what about increasing or continuing that enhanced FMAP that would very much help states like Wisconsin?
Eric, this enhanced FMAP is tied to the public health emergency. There's growing pressure from Republicans and some Democrats for an end date to this public health emergency. Do you think this new makeup of Congress maybe pushes that date forward? And how are hospitals preparing for this potential eventual end of the public health emergency?
Yeah, it's a constant issue, right? Because the PHE, public health emergency, has a number of things wrapped up in it. John just talked about some very, very important ones, and there's a good handful of regulatory relief. I refer to it as a big pilot program, and it's true. There's a big handful of regulatory relief that was granted for the purpose of increasing capacity in our healthcare system during COVID, and it's proven that some of these regulations are very archaic and obsolete. John mentioned one of them. There's others, particularly that affect rural hospitals and their ability to see patients. But back your question about Medicaid, we'll see, because that enhanced federal match also helped fund enhanced enrollment. And so you theoretically, as the PHE expires, the enhanced enrollment will go down, and that arguably is the reason for the enhanced federal match. We'll see. I do think that Wisconsin, as I mentioned earlier, we have fared quite well. We've proven in our uninsured rate, and I'm cautiously optimistic that we'll weather the end of the PHE, particularly given the fact that the generous tax credits for purchasing coverage on the marketplace, which is commercial insurance, those tax credits have been extended for a few years, and they apply to anyone over 100% of between 100 and 400% of FPL. So I think the tools are there for a smooth landing, if you will. I don't know about the inflation, you're going to have a smooth landing, right, but the tools are there for a smooth landing when the PHE expires and when it comes to enrollment.
Yeah, and just add on one of those, Tim, is I know the AMA at the federal level, not only trying to stop the 8.5% Medicare payment for physicians, but also maintaining the telehealth, and Eric sort of referenced it in the rural areas. Telehealth flexibilities are really important to provide care to patients. So, I know the AMA, which is our national organization, is doing a lot on those two fronts.
Yeah, a lot of this is getting government out of the way. I mean, yep. It is, and we've learned some great lessons on that during COVID, sometimes the hard way.
Excellent. Well, we've talked about a lot so far. We are quickly running out of time. We've talked about a lot. I think we could spend another hour talking about more stuff. But to sum things up, if you had to single out one issue, what do you think that the biggest healthcare issue will be in Wisconsin in 2023? Michael, let's start with you. We have about a minute left, so short answers. But if you had to pick an issue, what do you think it's going to be dominating healthcare in Wisconsin next year?
I think reproductive health.
Great. Gina?
I think the workforce shortage and trying to build pathways and pipelines and really supporting the folks that are doing that education.
Thank you. John Nygren, what do you think is going to be the biggest healthcare issue next year?
Well, I'm not going to disagree with either one of those two, but I'll add something to it. It's been discussed a little bit, but the public health unwinding, making sure that people stay insured in Wisconsin definitely has to be a priority for everyone. I know there's been smart people at the table trying to figure that out, but we need to make sure it all comes down to the devil's in the details and how it actually is implemented.
Thank you. Eric, what do you think?
Workforce, without a doubt, and cost. And on cost, I'll just say, taking a comprehensive and balanced look at what is contributing to the cost of healthcare in Wisconsin.
Thank you. John Sauer, we'll give you the last word.
Thanks, Tim, and it's a pleasure to be on the panel. Thank you for that. I would say sustainability of our long-term care system so that we can meet the growing needs of our aging population.
Excellent. Well, thank you all. This has been a really wonderful discussion. Appreciate all of your valuable time today. Thank you to our sponsors for making this important discussion possible. We'll be back in person for our next event on December 13th in Milwaukee for our annual hospital CEO roundtable. I hope to see you all there. Thank you all, and have a great rest of the day.
Appreciate
Thank you, Tim.
Thanks, everybody.
Have a good day.